Good morning and welcome to Webinar Wednesdays with SMP. We're glad to have you all with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP program. I'll be your host this morning, and presenting today will be Keith Havens and Jose Pinto. Today, for the May installment of Webinar Wednesdays with SMP, we're going to talk about telehealth fraud. During the presentation, you're welcome to type in any questions that you have into the chat, but we're going to hold those until the end of the presentation when we open it up for a question and answer. There will also be a prize drawing at the end of the presentation today. You must have been registered to attend prior to 10:15 a.m. this morning and be present to win. Before we get started, I do have to let you know that this project was supported by a grant from the U.S. Administration for Community Living. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official Administration for Community Living policy. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects under the U.S. Department of Health and Human Services and the U.S. Administration for Community Living. All grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and in Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And last year, we celebrated the 25th anniversary of the SMP program. Now, before we get started, we do have a quick polling question for you. So today's poll question is, have you ever used telemedicine or telehealth services? And give just one moment and I will launch that poll. You should have the option to answer yes or no. Have you ever used telemedicine or telehealth services? And I feel like probably a lot of us have, just because of the pandemic, and some of those appointments got changed to virtual appointments with our doctors, but we'll see. I'll give everyone just a few more seconds to vote. We're about at 80%. So please go ahead and select yes or no. Have you ever used telemedicine or telehealth services? Okay, so we're about, all right, so it looks almost pretty split down the middle. 56% of you said yes and 44% of you said no. All right, so next up, Keith is going to explain what telehealth services are and how fraudsters can use these services to commit Medicare fraud. So Keith, I'm going to turn it over to you.
Okay, so let's get a little deeper into what telehealth is. Telehealth or telemedicine is the provision of health-related services through computers, video applications, smartphones, and other digital or online technology. Now, telehealth was designed to help patients in rural communities that may not have access to certain types of healthcare specialists. It is designed to help with healthcare gaps and provider shortages by providing access to a specialist through telecommunications while reducing healthcare costs. Okay, so what types of telehealth services are there? Well, there are three main types of telehealth services. You have real-time video conversations, such as office visits and consultations with a specialist. Now, this is known as synchronous telehealth. You also have the sharing of patient information between providers, such as X-ray reports and laboratory results. This is known as asynchronous telehealth. And you have remote patient monitoring, also known as telemonitoring, which uses technology to electronically monitor and transmit patient information, such as vital signs or blood sugar testing. Now, probably one of the questions that you have is telehealth covered by Medicare or Medicaid? Now, Medicare covers most telehealth services in some form. In many states, Medicaid will follow the Medicare guidelines. As Medicaid coverage is different from state to state, it is always best to check with your provider to determine what telehealth services are covered in your state. All right, so what are the Medicare guidelines for covering telehealth? Well, for Medicare to cover telehealth, it must meet the following four primary conditions. First is the beneficiary must be located in a qualifying rural area. Next, the beneficiary and distant site practitioner must communicate using an interactive audio and video telecommunications system that permits real-time communication. Examples of this are the telephone or a computer. And next, the beneficiary must be located in one of 8 types of qualifying originating sites. An originating site is the location where the beneficiary receives the services through a telecommunications system. The site generally must be outside a metropolitan area and must qualify as a rural health professional shortage area. The sites may include a physician office, hospitals, rural health clinics, community mental health centers, skilled nursing facilities, and other specified places of care. A remote site practitioner may be a physician, physician assistant, nurse practitioner, clinical psychologist, and other health-related professionals. Now, importantly, for Medicare to pay for telehealth services, it must be coded Medicare Telehealth Services. Okay, so you may be wondering, well, how does telehealth, get involved with Medicare fraud? Well, unfortunately, telehealth is not immune to fraud schemes. Just a few of the schemes that have been seen with telehealth are billing for services not received, coding for services at a higher rate, as well as kickbacks and bribes for referrals. There has been a large expansion of telehealth services due to the COVID-19 pandemic and patients having to shelter in place. Due to this, the Department of Justice has seen an increase in telehealth fraud. Now, even legitimate telehealth companies may encounter cybersecurity incidents that can expose large volumes of sensitive patient data. So what are some of the common telehealth fraud? Remote patient monitoring for conditions such as those with irregular heart rhythms, patients with hard to manage blood sugar, or after surgery. The patient may wear a monitor and need to log in to the internet or connect with their cell phones to their physician's office as directed. The physician certifies that they have monitored the patient. Now, in cases of fraud, the patient may have been monitored by an unlicensed person, such as a medical assistant, or was not monitored at all. Yet Medicare was billed as if the physician monitored the patient themselves. Now, there are cases where a telehealth service physician or someone falsely claiming to represent a provider offers a brief phone assessment and video consultation. In many instances, the patient is prescribed durable medical equipment, hospice, or home health services that they do not need. The telehealth company works with a telemarketing firm to identify seniors in each area. Now, these are often vulnerable seniors. Now, what about telehealth fraud and cybersecurity? Another area of telehealth fraud is related to cybersecurity. This is when someone falsely acquires your personal information, such as your Medicare number, your Social Security number, a credit card or bank information, using technology such as the internet. Now, if you want to avoid becoming a victim of telehealth fraud or think you've been a victim, you should follow Senior Medicare Patrol's message. And now, to talk about that message, we will turn things over to Jose.
Thank you very much, Keith. I appreciate it. Hey, everyone. Good morning, good afternoon. Keith, guys, if you don't know, is the person that puts together all of our ads on the radio, television, or in print. So thank you very much, Keith. So if you see something from Senior Medicare Patrol in the media, it's Keith that put it together, and he puts together some great stuff. Now to get back into prevent, detect, and report. The first key is in prevention is protecting your personal information is your best defense against healthcare fraud and abuse. Treat your Medicare and Social Security numbers like your credit cards. Never give these numbers to a stranger. Remember, Medicare won't call you to ask for your Medicare number. Medicare is just like the IRS, guys. It's just like the Social Security Administration. They'll send you a letter if they need to talk to you or ask for your number, okay? And then you can call them back, and then you know who you're calling. So make sure. Medicare's never going to call you for that. Don't carry your Medicare card unless you need it for a doctor's appointment. And guys, that's very important. You don't need to carry it around with you like your driver's license or some other form of ID. It's not necessary. Keep a record of your medical visits, tests, and procedures in a healthcare journal or calendar. And that's very important, especially, you know, as we age, sometimes our memory isn't as good. So it's important that you guys sit down, write down the information, talk to your doctor, make sure whatever tests you're getting. And if they add it to your bill, or if they put something on your explanation of benefits, which we're going to go over in a second, you need to try and not just remember it, but go back to what you've been writing down. Go back to your notes. All right. And then we're at the second key is to detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare Summary Notice, or MSN, or Explanation of Benefits, EOBs, from your insurance company. Your Medicare Summary Notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Remember, everyone, read through those. Make sure that you go through them and compare to the notes that you took about the health care that you're receiving. It's really important that you do that. You want everything to line up. Compare your statements to your personal records and look for the following items. Charges for something you didn't get. Billing for the same services or supplies twice, also known as double billing, which is not uncommon. Services that weren't ordered by your doctor. If there's an x-ray on there and you didn't get an x-ray and your notes don't reflect the x-ray, question it. All right, the third and final key is to report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Do not be embarrassed. Do not think that, oh, this only happened to me. Fraud happens daily, hourly, every minute, unfortunately. You remember, most people that are perpetrating fraud, they do this every day, all day. They come up with great scams to figure out to separate you and your money. All right. So here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statements, call your healthcare provider or plan. And this is important. If you aren't comfortable calling your provider or you aren't satisfied with their response, call SMP. Guys, we're at 877-272-8720 and www.stopmedicarefraud.org. Also, we need volunteers. Please volunteer to help. Receive training. You might be wondering how you can become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join the fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we've had couples team up to volunteer, give presentations, and attend community events. Guys, I work every month with a great volunteer named Mark Becker. Mark, I think, is online with us. He does a great job, goes out into the community, and basically has become a voice in Cherokee County here in Georgia, as well as in Georgia in general, about Medicare fraud. This is an important process. Getting volunteers to help is important. It will make us and give us the ability to reach more people and amplify our message. So I can't tell you that enough. Also, interacting with Sunny, who is our volunteer coordinator, is a pleasure. She's a wonderful person and is very active with our volunteers and interactive either remotely, if you're here in Georgia or Mississippi, or in person in Louisiana. It's just a real easy and wonderful volunteer opportunity. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We'd be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. Together, we can fight Medicare fraud. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can also visit our website, www.stopmedicarefraud.org, for additional information about our program. Additionally, we would like to encourage you to scan the QR code using the camera on your cell phone that will guide you to our social media platforms, including Facebook, Georgia, Louisiana, Mississippi, and Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. I can't tell you guys enough. Please try and reach out and volunteer. You've taken the first step, taking this training. Try and take the next step and actually get out there and help us fight Medicare fraud. Protect, detect, and report.
All right, thank you, Jose and Keith, for the information on telehealth fraud and services. And thank you, Jose, for the volunteering for SMP pitch. And next month is our volunteering for SMP Hot Topics. So the whole month of June, our presentations and our webinar Wednesday at the end of the month is going to focus on volunteering for our program. So our next webinar is scheduled for June 28th at 10:30 Central Time. So just be on the lookout for information on how you can register to attend. And like Jose said, you can always give us a call and speak to me and get some more information on how you can become a volunteer for our program. All right, so now it is time for our prize drawing. So everyone who was registered to attend prior to 10:15 this morning, your names have been entered into our prize drawing for a $25 Walmart or Amazon gift card. So you do have to be present to win. So I am going to go ahead and give the wheel a spin, and hopefully our winner will be on. All right, it looks like Mr. OBW, and I'm not seeing him on, so we're going to remove his name and we'll give it another spin. All right, it looks like Mark B is our winner this morning. So Mark, I will be in touch with you shortly to get you the information so we can get that prize out to you. All right, let's see.